thanks everybody. Yeah, I know that telehealth or telemed, kind of used interchangeably, is something that has become much more interesting to most of us because our doctors aren't in their offices and we don't want to go out. And there are some real advantages to being able to have a virtual office visit, right in your living room. So we want to talk about that today. And first of all, I want to tell you that although telehealth is something that has popped up in the last month or so with COVID-19, it's been around for a while. So there are some doctors who have been using it all along to care for people in more remote areas of the country. But with Medicare opening up their ability to use it, there's much more interest on both sides, both from the professional side and from the patient side, on how to get together on programs like the one we're on now, where you can have that video connection. And I know one of the things that a movement disorder specialist told me once, probably 4 or 5 years ago, when we were talking about telemed, is he said, of all of the diagnoses that can be treated by physicians, movement disorders are some of the best ones to be able to address with telemed, because it's not generally a hands-on exam. And the things that a movement disorder specialist or neurologist might ask you to do, like this, you don't need to be in the same room with them to do those tests. And so to have a camera, they can look at you right there in your home and see how you're doing, and you can look at them in their home now often, and have those conversations that you'd have in the office. And I know Medicare is going to be watching. They want to see, is the care as effective with telemed, because it's booming now, and is there a difference in the number of office visits that people are making because they don't have to leave their home anymore to see their doctor. So what we're going to talk about today, though, is just basically what's it like to be on a telemed call with a doctor? How do you track symptoms? How do you prepare for that appointment? And before I get started, I wonder, does anybody have any questions that they just absolutely want answered before we are done today? Anything that's, a burning question or dilemma that you want to be sure we address? Okay, it looks like Myra?
Yeah, just mainly, telemedicine is something we've been working for a very long time. Knocking on doors in Congress and all to get that open. I think it would be valuable if everybody gets in touch with their their legislators and say how great it is and that it's really important and you want to see it covered. And a question is too, whether doctors can be covered over borders, because these larger states, it might be easier for someone to get to someone in another state, but because it's another, insurance coverage may not be. So just to make them more compliant with the needs of the people, bottom line.
Great points, Myra. And doctors, answering your question, doctors now, because Medicare has some emergency regulations because COVID-19, and from people I've talked to who are in the telehealth business, they say when Medicare puts in emergency regulations, they usually last at least a year. So they're not going to pull telemed out from under us real quick.
Right. We don't want them to do it at all.
Right, exactly. So we have time to advocate, and they have time to see that there's a huge benefit to it, and especially if we speak up. And then the other thing is that, like you brought up, the idea, and Judy was mentioning how some of her group members go to Minnesota, for the summer from the Phoenix area. Well, now with telemed, because doctors can go across borders to visit their patients, people can see their physician. So those Minnesota people can see their same doctor that they see in the winter time with telemed. So, and I think with movement disorders especially, there is such a huge benefit to that continuity, because your doctor, so much of your appointments are conversational, and keeping track of what's kind of trending in your symptoms, and the issues that come up. So it's a tremendous benefit.
And Judy, I'll condense a couple things from the chat just about communicating symptoms in that visit. So the emPowered tool, I think, will cover that. And then also, so symptom tracking, and then options for finding assistance with cost, resources for financial assistance.
Okay. Well, what we can do, Mary, I saw you had your hand up, it looked like, before I move
Thumbs
on.
up. I thought it was,
okay.
Speaking to legislatures was a good idea.
Okay, good. Well, then let's move on to preparing for that telemed visit. Have any of you been on a telemed visit yet with your doctor? Okay, Denise has. Oh, I see a few hands. That's great. So jump in with whatever I'm saying and share your experience or your knowledge as we go. But basically, with a telehealth experience, I'm going to show you our webpage, which will also allow you to go back and look at this information later. I'll show that to you in a minute. But essentially, preparing for an appointment with a video, either with your phone or with your computer, is very much like you would prepare for any appointment with your physician. The difference is that you need a space where it's quiet in the home, where hopefully you're not distracted, and it's easy for them to hear you. A couple of things you'll need as a chair, hopefully a chair without arms, that doesn't have wheels. A dining room chair would work great, or a kitchen chair. Because that way, during the visit, if you're asked to stand up or sit down or move, you've got that chair there and it's safer for you to use. A rolling desk chair isn't the best option for a telehealth visit. The other thing is to put your camera in a place where, of course, just like now, you're up on the screen and you can have someone with you. That's a very good idea, because at some point your physician may ask you to get up and move, to walk towards them or away from them. And so you need some space where you can not only do that safely, but the camera can see you do it. And most people find that either they find out ahead of time what works and move their computer or their phone to that place, or they have someone with them who does it for them. So those are the big changes. The other things that you can do that are very helpful and easy to do at home is to have all your medications in front of you. You can have a list, certainly, but and supplements as well. Medications and supplements, your doctor usually wants to know. It's really easy if you just put them all in a tray or something and have them in front of you. And that way, if you have a question or they have a question, you've got that information right on the bottles for you to be able to look at and read. So those are two things that are really important. Otherwise, though, of course, the conversation's usually about what's going on with your symptoms, and your medications. So what I'm going to do now is I'm going to do something. I'm going to share my screen, and I'm going to go to our website. So let's pop this up. Can you all see that? And I'm going to go to PMD Alliance. And there's that autofill feature Andrea was talking about. Okay, so then once that comes up here along the top, you'll see there's a special section we've added called COVID-19. If you go there, right down here, telemedicine and you, and click on that. This section is really up to date, really addressing the needs we all have now with this new coronavirus challenge to, getting care. So here's the web page. And as you'll see, we list some of our events. Here's one from yesterday. Here's a book by Ray Dorsey, you know, talking about ending PD. Telemed, what you need to know as a patient, and Lunch with Docs with telemedicine. This one is Dr. Ospina. She's a Phoenix movement disorder specialist, and she's used telemed for probably over 5 years. And so I was able to have a chat with her. It's on our YouTube channel, but you can just click the link right here and go to it. And she talks about what it's like to have a telemed appointment and what she's learned in her 5 years of doing it. Then over here is Dr. Boland. Again, here's the link if you want to hear from Dr. Boland. And she's in Florida. Dr. Ospina's in Phoenix. So Dr. Boland's in Florida, and she talks about her telemed experience as well. So it's really, these may be really informative for kind of getting the doctor's perspective on what's important. And they both talk about how they like to see patients and the important parts of being prepared and ready for those appointments. Any questions? Okay, well then let's go down telehealth, frequently asked questions. Here you can, I'm not going to go through all of these because, you know, they're all kind of separate conversations, but, you know, we were talking about Medicare and crossing borders and how long it's going to last and what doctors can do. Well, this section here, CMS is the Center for Medicare and Medicaid, and their fact sheets will tell you the latest information. So I suggest if you're wondering, like, what does my Medicare cover? How do I deal with this? What about prescriptions? That sort of thing. This is a good place to go to the CMS fact sheet and the summary of telehealth coverage. So a good kind of official place to learn more about issues around telehealth and Medicare. So here,
I have a question.
I'm sorry, did I hear someone?
Yes, Walt has a question.
Uh-huh.
Sometime before the end of this, can you explain how you got this split screen?
How I got the screen that you're seeing?
Right, how you split so that we're seeing your screen and not just your face?
Oh, okay, that is a screen sharing feature. So it's a part of Zoom.
It's part of Zoom, so you can.
Yeah, if you go down to the bottom of, and all the way to the bottom, are you on a computer?
Yes.
Okay, go down to the bottom of Zoom, to the very bottom, and you'll see the different things, the microphone and the video camera, and in there you'll see a share screen.
Right.
That's what I'm using.
Okay, so you just clicked on that share screen?
I did, yes.
And
And
that
then when
brings-
that comes up, then there's a little strip up at the top of my screen that says I'm screen sharing. And there's also a red button when I want to stop sharing. So you'd see me again.
And what you share is what's on your computer?
Yes, you're seeing exactly what I'm seeing on my computer.
Okay,
Yeah,
thank you
great,
very
good
much.
question, good question. Okay, so, you know, it's a perfect kind of segue to what if you're not comfortable using a computer, because here you are. So I hope you all do feel more comfortable, and the expertise that we've got that we can offer you, and just the persistence to troubleshoot and make sure you're able to get online and join with us is something that's really important. So that's a definite benefit. And of course, learning how to do things with video like you're doing now is going to be very helpful and make you feel much more comfortable if you meet a doctor online. So here, the Friends of Brain and Life tell you how to prepare for a telehealth visit. So there's lots of information between Dr. Ospina and Dr. Boland, and this link here, right here, where you can check it out, that's available. I think you'll find it's not very different from the things you're doing now, except for the camera being able to see you both close up and in movement. The thing I'm really excited to tell you about, though, is our empowered communication tool and the snapshot. I'm going to pull up, and you can do it right here. It's easy. Once you get on to the COVID-19 page, just click on the communication tool. It'll come right up. And there you see it. This is our empowered communication tool. When it's in paper form, it's a kind of booklet, but we found that you know, most people are looking at it on their computers. So we recently set it up so you can use it right from your computer. And going through it, you'll see information about PMD Alliance, of course, and specific to preparing for a telemed appointment, and is this important symptoms tool. And what you'll see, it's fillable. So I can put my name in here. And what this tool does, before we fill out any of it, I want to show you, there are several pages. They're categorized for different types of symptoms, but hundreds of symptoms, hundreds of situations you may run into. And you can see here, even things from dry mouth and swallowing. And then as we go down to the next page, depression, you know, all kinds. You could spend a long time just reading about these to find out. And they're not, you'll notice they're not listed by medical or Latin kind of names. They're listed by the common names that we call them. So it's pretty easy to go through and find what you're looking for in alphabetical order.
Hey, Judy, could you zoom in on your browser? I see some people squinting at your screen because the font is kind of small.
Okay.
Let's see.
I don't know if I can.
You're on a Mac, right?
Yeah.
Oh,
wait a minute. Wait. Let me see.
Perfect.
Oh, good. I'm glad you said that, Andrea. I'm sorry. Wasn't aware of that.
I'm trying to reduce my forehead wrinkles by not.
Oh, shoot. Well, good. Thanks for bringing that up. Because, of course, I don't see that part. I see what's on my screen. So I bet that's a lot easier. Okay, so you folks can see then, and I'll go back through here. It's important, you know, read it all when you open it up, but we won't do that now. But you can see the idea then is with that long symptoms list is to go through this tool and put an X if you experience the symptoms some of the time, and an A if you experience it all of the time. If you aren't experiencing it very seldom or not at all, you'd leave it blank. So for example, here, daytime sleepiness. I'm looking and I'm going to say, okay, today's 5/21. And that shows that this column is for things that I marked on 5/21. Fatigue. Well, once in a while, but not too bad. Freezing. Haven't had really any experiences. Nasal draining. Oh boy, I bet a lot of us could put an A on that right now with allergies and stuff. And what's important is to notice the symptom, let your doctor help you figure out if it's Parkinson's related or not. Maybe it's allergies, maybe it's PD, but to notice your symptoms. And then, you know, go through each one of these. Fear. Well, sometimes it's kind of scary right now. Might want to, you know, note that. Otherwise, I'm okay. Worry, maybe a little there, but then keep going through and you can see there's all kinds of things that are listed that you can mark on there. And over time, going back to the top, over time, as you fill in these different dates, maybe once a month, go through and do that, you're going to see, well, there may be some trends where you're Xing or putting more A's in on a symptom than you did in the beginning. It's your record then of kind of what's going on over time. And you can imagine you can use it either monthly, I'd say at least quarterly. But the other part of this tool is something that's discussed about in the text, but I want to tell you about it because not only is this a good record for you, because you can print it out from the website or you can use it online, you could have your spouse or a care partner or another family member also use it because sometimes they notice things differently than you do. And what you think may be not much of a problem they may see as a larger problem than you do. Or they may say, oh, if you compared yours, you know, you could say you noticed this, or they know they indicated something, and you can talk about it. So it's a wonderful communication tool. You know, you don't have to kind of pull out the symptoms out of thin air with your memory. You can go through this list and check it out together, and hopefully not only talk about what's going on, but probably figure out some ways to better deal with what's going on. So that's important to use the tool. And you can see it's set up with pages, so if you want to print it.
And Judy, Walt is raising his hand with a question.
Oh, good. I'm sorry, because I'm not looking at that. Thank you.
Thank you.
Walt?
Can you hear me?
I sure can.
Okay, thank you. I'm used to raising my hand when I want somebody's attention, so it works. Is it possible to fill in this chart with the dates and the information? Could we have one column be the date with the PD person's initials, and the next column be the date with the caregiver's initials, and therefore you'd have two columns for the same date with different answers by different people?
Well,
Is
let's
that
see.
possible?
So I'll chime in about this too. So
Go ahead. Yeah.
it's a fillable PDF, and someone else asked, instead of X and A, could I do a scale of 1 to 5 or 1 to 10? And you sure can. So we, you know, what Judy went over is kind of, you know, our recommended, but yeah, customize it if you want those columns next to each other, or some people want to go on a scale of, you know, 1 to 10 and just, you know, kind of be more granular and not just this bothers me or this doesn't bother me. So we did leave that, we didn't lock it in terms of the type of entry you could put. You can put anything. You could even, I mean, there's not much room, but you could write like, okay, bad, good, 2. So I don't know if that's terrible to share and it will confuse everyone, but I think the key would just be to remember your system and be consistent with your system, so that when you are, you know, so from 1 month or one use to the other, it's, you know, you don't go from 1 to 5 and then 1 to 20 and then back and forth. But does that help, Walt?
It does, and I'm wondering, if you were to do that, would you go someplace on the form and indicate what 1 means and what 5 means?
Okay, well, Walt, I think that you would probably, the form doesn't specifically address that. If you can see my screen
Right,
up here,
right,
you have the same day. A might be you, B might be your spouse.
right,
And you can see here, you know, you can put in what you want, as Andrea was talking about. So that this column could be yours, this column could be your spouse's. And then, but if you're using your own scale, what I'd suggest is that you note that and keep that record somewhere so you're consistent about it. This
right, but
is,
not
you don't
on the
have that
form.
scale. Pardon me?
But not on the form.
No, it's not on the form. Of course, that, you know, if you're printing this out, you can write it on the form anywhere, and keep track of that. So the idea is for you to make this as useful as you can for yourself. And
Okay.
everybody kind of has different ways of organizing their thoughts and their conversations and all of that. So what I would tell you is this form is for you to use in any way that it supports you. So go ahead and get creative. You can't mess it up. So get creative with it and, you know, make it work for you.
Is it possible to add a, not for me, but for you guys, to add a line to this form up above, say, acid reflux, and on that line, one could write where you have 1 okay, above that on a blank line, you could write 1 equals low, 5 equals high, and you could write that in the space right above 1 okay, and therefore this form would be, you'd be indicating more information right on the form instead of in your notes someplace.
And Judy, scroll down, there are some lines where you can
Blank
add.
lines.
Look down here. So you could actually do something yourself.
Okay, I
Okay.
got it.
To, maybe seldom, etc. If you can see that. So you can do that for yourself and, make that scale. I think, some people like using 1 to 5, some 1 to 10. It can be, however you're comfortable and you think it's helpful to set it up. So it's yours to do.
Okay,
And
Myra, I'm finished talking the situation.
Okay, I didn't mean to push you. But on the same thing, if we go up to the top of this one, this page that we had, or even, stop. Do you notice it, it gives you some other things. The blank is rarely or never or not bothersome. X sometimes. A, frequently, always. So that's giving you a little bit more information too.
Right.
Right.
That gives you a
Using
scale
those.
of 3. So it's a matter of how
Whatever.
granular you want your scale. So this would be a scale of 3, essentially. Nothing, X or A. Just make it show that it's manageable over time, and your categories are broad enough that when you go back and look at something you said 3 months ago, it still makes sense to you. That would be my suggestion.
That's great. You have this on
Excellent.
here.
Yeah,
Excellent.
yeah. So as we go down, you can see, and every page, other symptoms I have questions about for each of the categories. And then this last page, let's talk about it. Because sometimes it's difficult to talk to your doctor. In fact, a lot of people, they go to their doctors with kind of the same attitude as some people do when they're hiring a house cleaner. They clean their house. They don't want the house cleaner to know that they need their services. And that's not an unusual kind of thing to do also with your doctor. You go in and you want to be just as, healthy and capable as you can be. And of course, that's not your best use of your doctor's time. Your best use is to go in and discuss what's going on, what you've noticed, what you're causing you concern, what is and isn't working. The doctor is not going to perceive you as a complainer, although that's the fear. The doctor's going to see that, wow, I have opportunities to help this person. And if I come up with some good solutions, the next time I see them, whatever the situation, it should be better. And that's what that makes your doctor feel good, rather than coming in and having something just hang on and until it gets, more severe than it needs to be, or they just, they feel like you're not being candid with them. So it really is important to communicate with your doctor. The challenge sometimes is how to do that with any sort of kind of efficiency. And this booklet is going to help you by way of organizing your conversation first with each other and then with your doctor. And then I'm going to go back and go up here. Let's see. And I want to show you, shut this one. Whoops. Go back to telemed and you. There we are. COVID-19. We're on that page. Let's see. We'll go to COVID-19. And on that same page, down, whoops, did I get the right one? Yeah. There's a couple other features I want you to be aware of so you can poke around and find out about them later on after this meeting. And we're going to go to the snapshot. There's a link there for the snapshot. This is what you can do to kind of organize your thoughts for that appointment. Mm-hmm. Again, it's a fillable form. It's completed by, you can fill out you can make it as official. You can take this form if you want to, and you could save it and send it to your doctor ahead of time, or you could share with him or her during the appointment. But you can see here the importance of how organized it is. The symptoms that have gotten worse, the symptoms that have gotten better, both very useful information. If you could change one symptom or complication right now, what would it be? What would make the most importance? What's the most importance to you? So this is a wonderful way to take all of that information and condense it down to the things that you can talk about effectively in your appointment time. And again, it's available right on the page.
That's good.
Yeah.
You see how there's patient and care partner?
Uh-huh.
I've heard good use cases how each person does their own, and the physicians have told us that that's helpful too, because what's, for example, sleep. You don't know what you're doing when you're sleeping, but maybe your spouse or bedroom partner does. So they have a different perspective, and in this snapshot, have just have both perspectives representative to be able to share with the doctor.
Oh, that's great, Andrea. Thanks for bringing that up. That's really important too. Your doctor, the more information the doctor has, the better they can address what's going on with you. So, if the house cleaner comes in and notices that the kitchen's a mess, it's easy for the house cleaner to figure out, oh, I better work on the kitchen. So okay, now we're back at telehealth and you and the COVID-19. And there's one more thing that I want to show you that should be, whoops, okay.
Were you going
to,
just before we come to the end of the hour, were you going to go to the financial assistance part?
Well, I was going to go to the medication access.
Cool.
Yeah. Medication access, a lot of people say, what am I going to do? My meds, what are they? How do I find out about if I need help paying for them? I've heard of these programs where, companies will have special things they can do for me if I can't afford the meds. But what company, there's the name of the medication, who makes it, and all of that. That's kind of hard to dig up sometimes. So PMD Alliance, we know that. All medications is a complicated kind of thing to negotiate sometimes. And so you can see here, there's some more information about getting your information, how to order by mail, some suggestions for how to get help with getting them to your home. And then if you look here, there is a list as we go down. You all can see that. All these different medications by the name. There's also the Latin name for them. And what you can do, though, what's cool is, let's take a look, GoCovney. Well, how do you what happens? You click on the link, and there it is, medication access. Oh, GoCovney doesn't have medication access at that point. So you can find out, maybe there may be some, Mirapex. What does Mirapex say? So there's the medications. It gives you a phone number that you can call us. We can help you. You'll see, I happen to just pick another one that doesn't have access. Let's see. Andrea, do you know one that does?
If you go to
Maybe Apican will.
Nuplazid.
WorldMed is good.
So if nothing else, you'll know whether they do or don't. That's for sure.
Who gave the phone number?
Yeah, you've got a phone number. Nuplazid. Let's look. Somebody said Nuplazid.
Yeah.
There they are. And they're alphabetical, thank goodness, or I'd never find them. Oh, look at this. So Acadia, that makes Nuplazid, has a whole lot of information that you can do. And a phone number here to contact them directly. So this can be a really valuable resource for you on the access services, for medications and getting started with that. You don't have to leave the website to go find all these individually.
That's great.
It's much easier, and you can look and, decide what you want to do.
And can you show the financial assistance one in resources too?
Oh, okay. Resources. That's another one up at the top. Find support and resources for you.
The medication assistance is where we have the the financial
There it goes.
help.
So if you haven't really dug around in our website, please
It's
do.
great. Yeah.
You can see there's lots of information under each of these headings here. And then you can dig really deeply into each of them and find out a lot of different things. So medications, assistance tool, programs, cover my meds, needing meds, click on these. You know, let's pick on Medicare. That is something most people are interested in. Drug coverage, how to get drug coverage. So right there, you've got some basic information on Medicare. Let's, you know, there's other assistance, and there's a medication assistance tool. So there you go. Worried about affording your medicine. So dig deep. I can tell you that there's, and what's nice is once you get familiar with our website, it just gets easier and easier to go to the places. You can bookmark them like we talked about in the beginning, and it becomes a really practical, usable resource for you. So any questions, comments?
I missed you saying how to bookmark. Can you?
Oh,
and I knew how to do it, and people have helped try.
Okay, well, for me, when I go into bookmark on my Mac, you're seeing my screen, I just hit this little star here, and then it tells me the bookmark, and there's only so many bookmarks that can show up here, but if I say I want to add it, then when I go to my bookmark bar, wait, let me move this, and I go down, medication assistance information. There it is now. All I have to do is go down to there and it'll take me, click on it, it takes me right to that page.
Okay.
So, and of course, you know, with your particular browser, you can also go to help and look for how to bookmark, and usually it gives you right to assistance as well.
Yeah, someone else has helped me with it, and I can forget from time to time.
Yeah.
And
Okay.
next week, we're actually, the topic for Tech Connect is all about internet browsing. So we're going to cover bookmarks. We're going to cover Chrome and Chrome extensions. How come sometimes when I open a internet browser from a different device, I see the screen that I saw on my other device. So that was in response to some questions that we've had. But we're coming to the top of the hour, so I'll just do a quick wrap, Judy. So today I just wanted to, just to be able to share, you know, some of the tools that we have and break down if there's any, you know, technical problems with why people, you know, don't know how to use them. So hopefully that was great for Judy to run through that fillable PDF. And then also we realize it's tough with a website when you want to have so much information on it. It does make it hard. You know, if we only had one thing on our website, then it would be easy to find it all. But we build so many resources and we want to help in so many ways that we put a lot on our website. So we thought this would be helpful. So hopefully that achieved that objective as well. If you have questions about anything that we covered, info at PMD Alliance. I'll put that in the chat, but that's kind of your lifeline to us. And if you want us to just email you that PDF, the fillable PDF, or ask questions about anything else, let us know, email us there. And then, like I said, next week, Thursday at 9 a.m., we're going to be talking about browsing the internet. So bookmarks, Chrome versus Firefox versus Safari versus Edge, what's the difference? Let's see, I think we're going to talk a little bit about how to check your internet speed. So you know, wait, is it my device? Is it my Wi-Fi? Is it me?
Is it someone else if I'm watching a video?
So yes, Marie?
I missed one of the events yesterday about the pets. And do you have that in your archive, or, you know, Do you record them and save all of them or just some of them?
Nope, we save all of them unless it is a pharmaceutical branded presentation that the FDA doesn't let us, but we did do pets.
It is up already up too.
It is up already? Okay.
Yeah, I'll put the link in the chat so you can.
Okay.
I
You
can't
are
wait
quick.
this weekend. I want to train a dog to close a drawer with its nose. That was one of the things that the trainer covered. So so thank you all, and I appreciate your patience. And this is a new program for us, so it's kind of we're piloting and learning as we go and trying to figure out the right balance of too much tech, not enough tech, too much talk and discussion. So we appreciate, you exploring this with us, but where we're coming from is we don't want it to be just all boring, like, and now you click the mouse. We want some human, like, let's talk and chat with each other and use how we apply, like Judy said, for her women's church group and whatnot. So we're still figuring out what the perfect balance of all that is. And hopefully you join next week to learn about some of those internet browsing topics, and we'll continue to learn and grow.
Thank you,
I
Andrea.
have one real
Thanks,
quick question.
everybody. Good to see you.
Someone has a question.
Yes, Walt?
Okay.
Walt's question is, on the link that you gave for pdmalliance.org, blah, 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 is a case capitalization and small case relative, or it doesn't matter?
It doesn't matter. And
Okay.
it is PMD. So even though, it's Parkinson and Movement Disorder, a lot of people transpose those, but yeah, PMD Alliance.org. I typed it again in case it's easier to see it visually than hear
Right.
it auditorily. So
I just added one little note. Dr. Isaacson, when he did one of these earlier, mentioned the fact that this is a good time in terms of telemedicine. If you wonder about other doctors, maybe you could get a doctor's appointment through telemedicine to check other doctors out.
That's true. And the other side is if you're in an area where the local doctors have got a line out the door waiting for appointments, you're no longer confined to them now.
Right.
So you can look and find doctors who do have the ability to see you much sooner.
Thank you
Okay.
very much.
Thank you. It was good.
Thank you.
Really good.
Thanks a lot. Bye, everybody.
You are
Have a
so
wonderful day.
innovative. You just do it all. Take care.
Bye-bye, everybody.
Bye-bye. Have a good day, everybody.
You
Bye-bye.
too.
Be safe.